Okay, so we're going to be talking about our case study. First, we're going to dive into Ursula. So, Ursula is a 34-year-old female who is a hairdresser. She is married and has 4 children. She does have carpal tunnel syndrome. So, we're going to dive into what activities are difficult for her. So, as a hairdresser, it is difficult for her to work. She has to work 6 days a week to pay the salon owner for her rental chair. She wants to be back to work in 2 weeks. She experiences paresthesia from carpal tunnel syndrome in her right hand, which is that numbness and tingling. She experiences weakness of the hand. And she even wore a splint that she got off the shelf, but it decreases the use of scissors and her hair dryer. So those are some challenges for her. She has difficulty bathing and showering, getting dressed in the morning, specifically with her bra, shoelaces, buttons, zippers, and socks. She has difficulty with meal preparation, dropping silverware, and her husband's had to help with that. And then just home management tasks her husband has been helping out with instead. What she can do is functional mobility. Obviously, her lower extremities are not affected by carpal tunnel syndrome and transfers. So really what we're looking at that is difficult for her is these activities involving grip and hand manipulation and grasp. Okay, so diving into these deficits, we're going to address those. So dressing. So with carpal tunnel syndrome, we're really focusing on decreasing pain and edema to decrease the inflammation. And so some strategies we were going to implement so that she could get dressed in the morning would be just the use of adaptive strategies, such as using a pullover bra instead of a hook bra, where she's having to internally rotate and flex her wrist in an awkward position. She could also use slip-on shoes instead of shoelaces. She could also use add Velcro to her button-up shirts or zippers. Velcro is a great option, as well as possibly using a sock aid for her socks if she's having difficulty manipulating the sock to pull over her foot, or even using an adaptive device for that. For home management, some activities that we thought would be difficult for the next month for her intervention, without intervention, would be cleaning, yard work, managing appliances, washing clothes, cooking, and grocery shopping. Some alternatives to that that we thought would be good suggestions so that she could get back to those things in about maybe 2 weeks would be using built-up handles for meal preparation or feeding, alternating hands during activities, so switching hands, even though her left hand is a little weak too. It's not as severe as her right, which she had carpal tunnel surgery on. We even found some kind of modified grips on either brooms or mops or rakes for the backyard. And then also curbside pickup is a free delivery service that she could utilize for grocery shopping instead of having to pick up each item by herself, and then delegating to tasks to family members when necessary. One of her favorite leisure activities is bowling, and so obviously with CTS, she's going to have deficits there. As you can see, this girl here is doing wrist flexion, which is what aggravates carpal tunnel syndrome. And so until that pain and edema is managed, we would recommend the use of maybe using 2 hands or using the left hand or the lightest ball, and modifying the way that she can roll the ball. So maybe she can still bowl, but she just has to use both hands and alter her technique a little bit. Another thing that she enjoys is volunteering at church, which is a work occupation, but she did say that she enjoys it as a leisurely activity. And so that would just be avoiding activities that further inflame her carpal tunnel syndrome. Okay. And now going into performance patterns, her roles. So she is a mother, a hairdresser, a wife, church volunteer, and a bowler. We have here that as a mother, her role is not really impacted as much other than tending to the needs of her children. As a hairdresser, it might be about 6 to 8 weeks before she can return full-time to work, and she expects to return in 2 weeks. So that might be difficult, but by gradually introducing adaptive strategies, such as taking rest breaks and stretching and giving her home exercise program to help with her recovery, would be beneficial in helping her return to work. As a wife, her responsibilities have not changed much. As a church volunteer, she might need to do activities again that do not aggravate her wrist. So if she's having to do fine motor tasks such as, I don't know, manipulating objects or organizing things, she might want to do something that utilizes maybe functional mobility and not necessarily grip strength, maybe carrying with her upper extremities, but not having to grip with her hands. And then as a bowler, obviously, like I said, modifying the activity and decreasing edema and pain before returning. So then going into routines, her 3 biggest routines are dressing and bathing, and then meal preparation. So with dressing, her daughter actually helps her, and we already talked about those strategies that she could utilize, such as, pullover bras, using Velcro and things like that, altering the types of clothing. However, with bathing and showering, she does not want assistance. And so one of the things we talked about was maybe she would benefit from a long-handled sponge with like a little bit of a built-up grip. I found this one. Thought that might be useful in helping her to shower and get all the places she needs. And then with meal preparation, she already did adapt by allowing her husband to help prepare the meals, but she might also, again, benefit from those built-up handles or even a universal cuff if that's going to help her continue to perform this occupation. And performance skills. So the motor skills affected, her grip was impacted, and she had experienced a decrease in grip and pinch strength due to carpal tunnel manipulation. The finger flexion involved in hand manipulation irritates her wrist, causes more pain. Coordination is affected because the carpal tunnel syndrome has decreased the amount of strength, and so she's dropping objects. She almost dropped a hairdryer on the job. Reaching is difficult because she experiences weakness in her right shoulder. She tested 3+ strength out of 5 on a manual muscle test there. So that told us that her right shoulder was weak. That might hinder her occupational performance. Lifting, she had difficulty lifting with a flexed right wrist due to weakness and pain. Again, transporting, since she's dropping these objects before they can even be transported, she's experiencing difficulty there. Calibration, she's having difficulty holding objects or determining how much strength she needs to use because she's not getting enough well, one, sensation and motor activation because of that nerve compression. And then flow, she has a decrease in flow movement due to decreased function of the wrist. So things aren't as smooth as they should be. Endurance, she's fatiguing more quickly because wrist flexion and is experiencing pain. And then pacing, she's a lot slower with her movements due to the weakness and pain. Now, some of the skills that aren't affected are the process skills, social interaction skills, and motor skills. So process skills, she can attend, she can heed, she can use, initiate, continue an action, sequence what she needs to do, terminate, and search and locate objects that she needs. Her social interaction skills are great. She's producing speech, gesticulating, speaking fluently. Carpal tunnel does not have an impact here. And then motor skills, she can walk and functional mobility and all that. So using those in a way that can help her best benefit from OT intervention would be helpful. Okay, so activity analysis. So when we think about what a hairdresser does day in and day out, most of the time they're brushing your hair, using shampoo and conditioner to give it that silky quality that it needs, and parting hair, blow drying hair. These are all occupations that or activities that she does throughout her day, as well as cutting hair. So for shampooing and conditioning, it would be great if she had pump bottles on hand, which I believe they normally do, but maybe some hairdressers don't. But having those on hand just so that it decreases that wrist flexion, she just has to push down and grab. Using a thicker grip on a brush would be helpful rather than one of those thinner brushes that might have a smaller grip and require more finger and wrist flexion to hold and manipulate. And then blow drying with hair. Again, we were thinking more along building up that handle to help with that. There are even blow dryer stands that she could use. I didn't post a picture here, but there's a, you hook the blow dryer up to a stand and it can just stay in one spot and you can have the client move rather than move the hair dryer. Which that is also another option. And so with the cutting hair is probably the most crucial. It's very important. The more research I was doing on this is like the position that the hands hold the scissors is super important. There are such things. There's such a thing called oh my gosh, ergonomic scissors. And what I found was these scissors here in this picture. I don't know if you can see it. Let me see if I can zoom in a little bit more. Here we go. So this right here is an example of the left side is an example of normal shears, and these are the ergonomic ones on the right. And so you can see there's more of a relaxed position, on this picture here on the right, as opposed to the left, and the elbow automatically drops down when that wrist is relaxed. There's reduced thumb motion, so there's less range of motion required for the thumb, so that means less stress on the joints and the tendons. And then lastly, we have a relaxed elbow and shoulder and thumb position. So that shoulder isn't having to wing out to the side and abduct as much, which is beneficial to the client. And so now we're going to show a quick little video about these scissors because I thought they were really awesome. And I think we should learn about it. Let's see.
Has finally made an appearance.
All right.
First things first, when you look at a pair of scissors, and this is the 6-inch cutting shear, 6 1/4 inch, I'm sorry, cutting shear from Samvia. If you look at the shear, they have these big holes in them for your fingers. That doesn't mean that you should stuff your hand all the way into those holes. What we want to do is we want to keep the scissors actually up in our fingertips as we're cutting. Once we're here, we're pretty stuck. We have one hand position, and it also creates more of that fanning effect with our fingers rather than getting our fingers to stay still. So first tip is keep your scissors up here in your fingertips. What that does is it allows me more movement and rotation of the scissor, and that's something really essential. What do you guys think is the first thing to go on a hairdresser? Right here, it's our wrists. So if the only way that you can change your scissor position is by bending your wrist in awkward positions, you're not gonna have a very long career. That's also part of the reason why we've shifted this thumb piece forward on our scissor so that you're not having to put your hand in such awkward positions as you would if this thumb is all the way back here. You guys can probably see that at home, the difference in how awkward my hand gets if I shift back here. So what we want you to practice is we want you to practice holding this part of your hand still and only controlling the scissor by your thumb. And it's not by jamming the thumb in there, it's by controlling it through pressure through your thumb. I'm actually pushing down just slightly and then forward just slightly. So that's what opens and closes the scissor. Great way to practice this. You can sit at home on the couch and just lay those fingers right on your knee and just make it so that you can only open and close with your thumb. That's a great way to practice this. The guy that apprenticed me made me do this all day long, all the time. I hated him for it at the time, love him for it now. The other thing I want you to do is I want you to try and rotate the scissors into different positions. What we found, again, is if you can control the scissor in many different hand positions, you don't then have to tweak your wrist, and you don't have to end up with carpal tunnel surgery. So after you get the thumb movement down, start forward, learn how to control this way, come to the side, learn how to control this way, and then even let the scissor rotate back and away and be able to cut this direction. So now how that translates onto a head of hair is if I'm on top of the head, instead of having my hands stuck in a certain position and having to do this to point cut, now I can let the scissors drop into a much more natural position. And if you see, my wrist is in a very natural position, and I can just use my thumb to control the scissor. This is much, much better on my limbs than having to do this. I'm sure you guys can tell the difference, right? So those are the main key points on scissor control is, again, make sure that your thumb's doing the work. Keep your scissors up in your fingertips so you have control forward, middle, and back so you can rotate them around without having to tweak your wrist. And I really want to challenge you guys to take the time and practice that movement. I guarantee if you sit at home and you actually practice these movements and get great scissor control, A, you're going to have a longer career, and B, you're going to start getting compliments from your coworkers and your clients that you just look very elegant and graceful when you cut hair. That inspires confidence. Confidence is what gets you more clients. So practice this at home. Let us know how it works. Hit us up on the Facebook page. Give us comments on your...
Okay, so, oops, that was that. I'm going back to the page. Here we are. Okay, so key takeaways, he did say with those scissors that the ring finger and the thumb should be parallel. So I never actually looked at hairdressers when they're cutting, but as you can see, the ring finger and the thumb are in the same direction here in this picture. You should only move the thumb when cutting. And the thumb is having that decreased range of motion with these adaptive ergonomic scissors. And then making sure the fingers aren't all the way through the holes of the scissors so that you can rotate the scissors within the hand without having to tweak or flex the wrist, which I thought that was really cool. And then last but not least, before we move on, we're just going to talk real quick about hand function. So obviously Ursula is going to need adaptive equipment in some way if she's going to try to get back into work before going back full-time 6 months, 8 months post-op. She's going to need environmental modifications, whether that's her clothing, her environment, um, the type of scissors she's using, hand pumps, brushes, um, shoes, all those things. And then she's going to need lots of just scheduled breaks in between, just to make sure that her hand's getting that rest in between, that she's um, continuing to take care of her needs and stretching out that wrist, making sure it's not getting inflamed. And we're going to move into more of that in the next um, concept map. So now I will be passing it off to Minetta.
So now we are going to move on to the client factors portion of our concept map. And we are going to start with Ursula's values, beliefs, and spirituality. So Ursula values her family. She comes from a large Southern family, and she also has 4 children and a husband of her own. She values her work as a hairdresser, and she also values her independence with her ADLs. Ursula believes in sharing equal responsibilities of the house with her husband. This is important to keep in mind because it is important for Ursula for her to help her husband out and take on some of the responsibilities of the household. So OT should work to create goals that align with returning some of that independence to Ursula so that she can complete some of those tasks. Ursula also believes that if she does not return to work, she will lose her spot at the salon. Returning to work is the only way that she can pay rent on her booth. And since that salon is very important, she believes that if she can't pay rent for her chair, that she will eventually lose her spot. Finally, Ursula is a very spiritual woman who draws her strength from her religion and her ties to her church community. This is going to be helpful during her sessions because Ursula will not only be motivated to complete the sessions, but she also will be very optimistic and committed to her recovery. Her spirituality translates into her volunteer work, which she is also very anxious to return to because it's an activity that not only gives back to her community, but involves her entire family. Now on to the body functions. So as far as Ursula's mental functions, there are no deficits noted in Ursula's at a higher level cognitive thinking, her attention, memory, perception, and thought, and her ability to sequence complex movements are all intact. We did note that her strengths include her temperament and personality, again, that upbeat optimism, her drive, and her emotional stability. As far as her sensory functions, there have been noted deficits in her right and her left hand and wrist. She has sensory deficits for light touch, for sharp dull, for deep pressure, as well as for hot and cold. For Ursula's neuromusculoskeletal and movement-related functions, there are noted deficits in her joint mobility, and this is due to the slight edema in her right hand and fingers. There are noted deficits in her muscle functions. A grip strength test was performed on Ursula's left hand with a dynamometer, and she was able to grip about 25 pounds. Average for her age is about 57 to 65, so she is in a lower percentile. Her right hand was not tested due to the recent surgery. A manual muscle test was performed, and Ursula scored a 3+ out of 5 for her right shoulder, a 4 out of 5 for her left shoulder, and a 4 out of 5 for both elbows. For skin functions, we just want to be aware of the wound healing from her recent carpal tunnel release surgery. Now to move on to Ursula's body structures. So we will begin with the interventions for her right hand and wrist. And we gave 3 interventions that we suggested, and this was a home exercise program, splinting, and sensory re-education. So for the home exercise program, we wanted to urge Ursula to perform some tendon gliding exercises as well as some median gliding exercises. And so these exercises are going to help promote digital and joint motions as well as help with some of that scar tissue that may be forming from her recent surgery. Ursula should be advised that these stretches should be stopped if there is pain present. So for this first tendon gliding exercise, and this is right from the Radomski text, the client is just going to start with their hand straight and gradually go into a full fist. The median nerve gliding exercise is a little bit more advanced. The patient starts in finger flexion and then moves into finger extension, tilts the hand back, and eventually goes into stretching out the thumb. Again, this would be advised probably towards the end of week 1 going into week 2. And you just want to urge Ursula not to do these exercises if she is experiencing any pain. The next intervention that we have is a splint. So we recommended a wrist volar splint with Polyflex 2 material for Ursula, and we did make this splint in class with Lohman. The wrist should be placed in neutral, and the purpose of this splint is just to allow anatomical structures to rest and stay in neutral and maximize carpal tunnel space. This is going to decrease pain, paresthesia, and edema. And for the wearing schedule, Ursula should be advised to wear this continuously post-surgery all through week 1, going into week 2. And week 3 and beyond, she should be advised to wear the splint at night and during any type of aggravating activities. The next part of our intervention includes sensory re-education. So we have 3 activities here that we would send home with Ursula to do. The first is a tabletop touch therapy. So Ursula would just be advised to gather objects with different textures and place them onto a table in front of her. She would then, some examples of these objects include soft scars, rough sandpaper, fluffy cotton balls, Velcro, or cool silverware. And then without looking at the objects, Ursula would be advised to pick them up and feel them and try to distinguish the difference between the textures. The next activity is temperature differentiation. So Ursula would soak a cloth in cold water and then another cloth in warm water. She would then have someone like her daughter or maybe her husband first place the cold cloth on her arm. She would be advised to notice the sensation and how it feels and how it would have felt before she had her carpal tunnel syndrome. After about 30 seconds, she would then switch to the warm cloth and try to sense the difference in temperature. Ursula would then be advised to close her eyes and have someone, again, like her daughter or her husband, place one of the cloths on her arm, and Ursula would need to try and determine if it was a hot cloth or the cold cloth. And that would be done for several tries. The last exercise is a texture hunting. So Ursula would fill a bowl with uncooked rice and bury different textured objects within it. Some examples of the objects include marbles, coins, Velcro strips, and cotton balls. She would then reach her hand into the bowl and try to find the objects without looking. I did want to note here that more research does need to be done towards sensory reintegration and its effectiveness on improving tactile discrimination and hand function for carpal tunnel syndrome. These exercises right here are used for patients with stroke and reintegration, but there has not been a lot of research. It's very limited on the effectiveness on these exercises with those experiencing deficits from carpal tunnel syndrome. So it should be cautioned when recommending something like this for a home program if no improvement is being seen, to maybe discontinue or try to find some more research to support this approach. Next, for the treatment of her edema on her right hand and wrist, we recommended the RICE program. And so this program is just going to help with the edema that Ursula is experiencing. So rest, obviously she would be using her orthotic to be worn during her advised schedule and during aggravating activities. Ice, so applying ice packs for 10 to 15 minutes on and 10 to 15 minutes off. She would be advised to buy a properly fitted light compression garment, and then to elevate the hand above her heart when she is noticing that edema. Next, we're going to move over to Ursula's left hand and wrist, which is right now also experiencing symptoms from carpal tunnel syndrome, but her physician did not believe that it was too far exasperated to actually have to do surgery. So what we suggested for interventions was an exercise program, another exercise program. So in addition to the tendon gliding exercises, Ursula can also perform some stretches. So this first picture is a wrist extension stretch. And so you would just advise Ursula to straighten her arm and bend her wrist back as if signaling someone to stop. She would then use her opposite hand to apply gentle pressure across the palm and pull it forward until she felt a stretch on the inside of her forearm. She would hold that stretch for 15 seconds and then repeat 5 times and then perform the wrist flexion stretch, which she would straighten her arm with her palm facing down and bend her wrist so that her fingers are pointing down and gently pull her hand toward her body until she felt a stretch on the outside of her forearm. She would hold that stretch for 15 seconds, repeat 5 times, and then so we would advise Ursula that she would not want to do these stretches with her right hand and wrist until the bandages and stitches are removed from her carpal tunnel release surgery, and that that scar has kind of healed some, because we do want to keep that wrist in neutral. So these exercises would only be for the left hand as of right now. We also suggested a splint. And so this is going to help, again, minimize that pressure on the median nerve, prevent bowstringing of flexor tendons, and provide support during stressful activities. Ursula would need to be advised to adhere to her wearing schedule, which is wearing it at night and while she's at work, because this is something that she was not doing before. And she just needs to be reminded that not adhering to the schedule is going to make her symptoms worsen. Ursula then should be advised to avoid any type of constant repetitive movements, extremes of forearm rotation or wrist motions, and any type of sustained pinch or forceful grip. Again, this is going to be very hard for her to adhere to just because of the demands of her job. So you think about all of the motions that go into doing hair. And so we're just going to have her either have some adaptations or find ways that she can incorporate more breaks into her job. And this last part is just showing the sensory and motor distribution of the median nerve. And there's a picture there as well. And for this last part, so as Ursula was in the clinic, while she was performing some gross motor coordination activities, it was observed that Although Ursula is able to reach an object, she's moving with her whole body, and her shoulder is elevated and abducted when she attempts to reach. So obviously, Ursula is using her body to compensate while she's reaching. And if you remember, Ursula scored about a 3 plus and a 4 out of 5 on her right and left shoulder. So she is experiencing some shoulder weakness, and her bad posturing is most likely the cause of this compensation. So we recommended some shoulder strengthening exercises, and these include lateral raises, serratus push-ups, and standing lateral scapula pinches. So now I'm going to pass it over to Lupita so she can talk about the context and environment.
So now we'll move into the contexts, which are broken down into personal factors and environmental factors. For this client, we want to take note of certain personal factors which could influence our intervention. Her age is 34. Ursula's personality is energetic, upbeat, easygoing. She's receptive to therapeutic intervention. She's rather anxious because she wants to return to work full-time within 2 weeks. She's independent. She values being independent in her ADLs, IADLs, and being employed. She's hardworking and works full-time. She's female and she's a wife, so there are certain roles that she expects of herself. Also being a mother of 4, which means she's family oriented. She's a caregiver for children ages 5 to 17, and she shares those roles with her husband. Her coping style could be said to be emotion oriented, and she has that social support which she leans on. Professional and professional identity, she's a hairdresser. Some cultural factors could be that she's Black or African American. She is very strongly religious and her faith is important to her. And she's an urban resident. Moving on to the environmental factors. Some temporal factors are that within 2 weeks, she wants to return to work full-time. She currently rents a chair at a salon, so there is some pressure that she's feeling as far as returning back to work as soon as possible because it's a busy and well sought after salon. And she works 6 days per week. Some natural and human-made environmental factors include working indoors, being on her feet. As far as products and technology, she mainly would be adapting or going back to using those salon tools that she's accustomed to, which include the use of bilateral hand use, fine motor skills, strength, repetitive movements. As far as her support and relationships, her family, mainly her husband and daughter, have been the greatest supports, and her church community. Health conditions and fitness status. Of course, we know she has carpal tunnel syndrome. Other conditions are unspecified. We don't know about her weight or BMI, etc. We do know that she is a smoker and she takes 2 smoke breaks at work. Now moving on to the adaptive equipment and adaptations that we have chosen for her. In the ADL of self-care, we have dressing, and we've noted that Ursula has had trouble putting on her bra, so we would recommend 1 of 2 types of bras for her, such as the pullover bra or a front closing bra. These are also things that she would be able to use even after she heals. They're affordable, they're readily available online or in stores. The use of a sock aid so she may easily dress herself. This is rather inexpensive. There are many options as well. A slip-on or Velcro shoes. Comfortable shoes are important even after she does go back to the level of intensity at work that she's used to. this would be something inexpensive that she can continue to use. Velcro clothing would be recommended, as she can skip the steps of buttoning those small buttons or zippers. She could adapt clothing that she already owns, and family could actually help her with this. As far as bathing, we would recommend a long-handled brush or sponge, something she can access easily and continue to use even after this intervention is over. Oral care, the use of foam or a built-up handle would be very useful for this client, as we would want her to maintain a wrist in neutral position, avoiding that excessive wrist flexion, and avoiding vibration even in her left hand is important. So we wouldn't really recommend an electric toothbrush unless it was vibration being used therapeutically. We do know that Ursula now is showing signs of carpal tunnel syndrome in her left hand as well, so we want to prevent further damage. Accommodating for a diminished grip is one of the main reasons why we would recommend this, and it's quite inexpensive, readily available online on Amazon, and can be as cheap as $9, adapted for different items that she needs throughout the day. As far as meal preparation, a very important thing of her role as being a mother and a wife, and just for her own sustenance, she needs to be able to prepare meals. Groceries could be easily adapted for. Curbside pickup is free at most stores. Home delivery is readily available through the phone app for Instacart or Shipt. The price for this would vary. As far as cooking, we would also continue to recommend build-up handles or grips to modify the utensils that she already has, or if she would like, she could also purchase utensils that are modified. A universal cuff is also a good option for her. Finally, we move on to work modifications. Some behavioral modifications include scheduling and structure, taking frequent breaks, less complex clients, delegating some tasks if possible to assistants or trainees, and working with the owner or the staff to determine what short-term adaptations can be made in order to demand less of her and ease her back into work, allowing her to heal. Some equipment modifications. She could use that foam grip to modify tools that she already has, such as combs, brushes, electric razors. We would want her to opt for that instead of using scissors, which might be hard to modify and require a lot of fine motor skills. Next, and finally, we would want her to invest, if possible, in ergonomic or lightweight tools, such as a rotating curling iron, which can prevent excessive supination and pronation. And some lightweight options exist as far as hair dryers. Some are affordable, some are more high-end. Again, this would be an investment for her. Overall, we want her to require less strength when using these tools for so many hours during the day, 6 days a week. And finally, we want to address how we came about designing this intervention for Ursula. So some theories and evidence include from our orthotics books by Capart and Lohman. We determined that a neutral wrist immobilization, volar splint, with available finger and MCP flexion and extension would be best. The splint maintains her wrist immobilized in a neutral position, thus maximizing carpal tunnel space for those 10 structures that reside within there and are currently healing. This will result in decreased pressure on the median nerve, aiding in blood circulation as well, decreasing her pain, promoting that rest and healing. The reason why we chose a volar one is it can aid in early scar management. Ideally, an OT would add silicone elastomer or autoform. Next, the digits and metacarpal phalangeal movement is important so that she can continue to be engaged in those functional activities. And a full-time or nighttime wearing schedule is important because it has shown statistically significant reduction of pain and improvement in functional activities when compared to the use of no splint or a different kind of splint. The theories and evidence which pertain to the approach are biomechanical frames of reference, occupational adaptation frames of reference. Both of them would be useful at different stages of the OT process for different barriers to occupation. Biomechanical would be best suited for patients with an intact central nervous system, as well as addressing those body structures and functions which are limiting the client, such as strength, endurance, range of motion. And this is coming from Radomski and Latham. Occupational adaptation frame of reference would address the environmental demands required. Finally, we have from Pedretti, we have postoperative management. Ideally, treatment begins with immobilization within the first 3 weeks, 2 to 3 weeks, and then we would want to remove the splint as soon as possible. Preparatory methods include protective stretching, nerve and tendon gliding. Activity and occupations are important because we would conduct an activity analysis to see what kind of tools she is used to working with, how she uses those tools, and thus be able to modify the tasks. Finally, in postoperative management, muscle, sensory, and functional testing is conducted throughout to address loss of sensation, so vibration, perception of movement, constant touch sensation, scar management, scar adhesion, and scar tissue are important to keep track of.
Moving on to the intervention plan and goals section. Our long-term goals are: within 4 weeks, client will improve independence with ADL task performance while maintaining safety. Within 4 weeks, client will independently perform IADL tasks while utilizing compensatory strategies and adaptive equipment to maintain safety. Within 4 weeks, client will independently perform basic hairstyling techniques while using adaptive equipment, compensatory strategies, and maintaining safety precautions. Our short-term goals are: within 4 weeks, client will independently demonstrate safe nerve gliding techniques to perform daily at home. Within 2 weeks, client will perform IADL tasks with Min Assist while utilizing compensatory strategies and maintaining precautions. And within 1 week, client will independently demonstrate awareness of post-surgical hand and wrist precautions for right upper extremity while performing work-related tasks. Our first priority with our intervention plan is patient education. It is important that Ursula understands the seriousness of not allowing her extremity to rest and how repetitive strain on the structures could be worse if not addressed. A good example would be to explain how not wearing the store-bought splint prior to needing surgery led to increased damage. Non-compliance will only cause additional injury and lead to more therapy, which could cause extra stress on her work and personal life. In our scenario, a CODA could be responsible for all interventions that they are competent with. This can include working on strengthening, range of motion, sensation, monitoring improvement, using physical agent modalities, completing reassessments, and reviewing home exercise programs. and there needs to be an agreed upon level of supervision between the CODA and the occupational therapist. Some possible obstacles to Ursula's recovery include lack of home exercise program compliance, discouragement, and progress regression. We could address these problems by emphasizing patient and family education. Ursula should be informed that compliance with the physician's orders and home exercise program will increase the speed of recovery. She should also be informed that the speed of recovery varies between each patient and that her body may need longer to heal. We could also encourage her to continue participating in the activities that help motivate her, like attending and volunteering at church. And this can be done through collaboration with Ursula to help her think of alternative ways that she can still volunteer without causing further injury to her hands. Next, we have physical agent modalities. Their role in occupational therapy is to modify specific client factors that may be limiting occupational performance. It is the use of various forms of energy to modulate pain, modify tissue healing, increase tissue extensibility, modify skin and scar tissue, and decrease edema. CODAs can use physical agent modalities if state regulations allow it. The occupational therapy assistant must also be adequately trained and demonstrate competency to use the recommended modalities. When an occupational therapist delegates the use of a physical agent modality to a CODA, both of them must comply with appropriate supervision and state regulatory requirements to ensure service competency. It is important to note that only occupational therapists with service competency in this area may supervise the use of physical agent modalities by a CODA. For our intervention, we could use hot packs, ultrasound, and biofreeze. Ultrasound reduces inflammation, it breaks down scar tissue, and increases local blood flow to increase healing rates. And biofreeze can be used at the end of the visit to address pain. There should be no signs of an open wound when using these modalities. Basically, the use of physical agent modalities works as a preparatory method that can decrease pain and promote healing in preparation for occupational performance. Physical agent modalities must be incorporated with occupational therapy interventions for the purpose of regaining function. Next, we have two situations. The first one is Ursula is having a difficult time coping with her recovery. She feels it is going too slowly and that the doctor lied to her about how fast it would take her to recover. She is getting discouraged and saying things like, "I'll have to give up my chair at the salon." She also has noted that she is doing her home exercise program only when she feels like it, since it doesn't seem to be helping anyway. In this situation, we could start by addressing Ursula's concerns with the recovery timeline. It is important that she is aware of the progression and what is required of her to achieve her goals. We would thoroughly explain the benefits of home exercise program adherence and its contribution to a smoother and speedier recovery. To lessen her stress about work, we could introduce adaptive equipment and implement environmental modifications while she continues with therapy. However, it is critical that we let Ursula know that she cannot overwork herself because it may cause re-injury as well as slower progress. As much as she may want and need to go back to work, she needs to follow the precautions and contraindications that come with carpal tunnel surgery. It is typical for surgeons to provide the therapist with post-op protocols, and this can be shown to Ursula to give her a guideline of how the treatment progresses. The next situation is Ursula comes to therapy alone, but one day her husband accompanies her to see how her therapy is going. It is a typical busy day, and you are seeing two patients at a time. While one is doing an activity, you are working with the other. The patients are close enough so that after the session, Ursula's husband pulls you to the side and angrily accuses you of spending more time with one patient, saying that the other patient is richer than Ursula. For this situation, we would calmly acknowledge her husband's concerns and let him know that skilled therapy services were provided to Ursula. We would explain that our client's insurance or personal income does not affect how we treat, especially because as a part of our code of ethics, we promote equity, inclusion, and objectivity in the provision of occupational therapy services. Ursula does not understand what carpal tunnel syndrome is or why she has it, so we created an information booklet for her. This booklet covers the definition of carpal tunnel, which states carpal tunnel, also called median nerve compression, is a condition that causes numbness, tingling, or weakness in your hand. The causes states due to pressure on your median nerve, which runs the length of your arm, goes through a passage in your wrist called the carpal tunnel, and ends in your hand. The median nerve controls the movement and feeling of your thumb and the movement of all your fingers except your little finger. We also included signs and symptoms, which include burning, numbness, tingling, pain, swelling, loss of sensation, and weakness. And we have prevention methods such as taking breaks, stretching, maintaining proper posture, staying warm, switching activities, and keeping your wrist in neutral. This part is especially important to Ursula because she is showing early signs of carpal tunnel syndrome in her left hand. Then we have what treatment typically looks like, including therapy, and then surgery. If she were to have surgery on her left hand, it states that her doctor would cut the ligament around the carpal tunnel to take pressure off the median nerve and relieve her symptoms. We also created a home exercise program for Ursula. She has improved in all areas of range of motion, strength, and pinch, but these have not returned to what they should be for her age and profession. For that reason, the home exercise program covers tendon glides, median nerve glides, scar massage, therapeutic exercises for finger flexion and extension, and AD and abduction. There's also wrist flexion and extension exercises, as well as pinching. We also included rice desensitization to address her loss of sensation. And we thought that this home exercise program would be useful for Ursula because it comes with pictures as well as step-by-step instructions on how to complete the exercises. We would impress the importance of home exercise program adherence by explaining the negative effects that could result from non-compliance. Our intent is not to scare Ursula, but to educate her on her body structures that were affected and how the home exercise program works at healing those structures and functions that were damaged. Lastly, we have our discharge summary. It basically covers a description of the OT intervention, saying Ursula engaged in outpatient hand therapy for 4 weeks to address deficits in range of motion, strength, endurance, and sensation as a result of carpal tunnel release and prolonged median nerve compression. Ursula tolerated 1-hour therapy sessions, and we also included her long-term goals. And for the summary, that states Ursula has made gains in all areas of range of motion, strength, grasp, and pinch strength. However, further adherence of home exercise program will be necessary to increase gains as they do not meet age-appropriate levels. Her sensory deficits continue to be present, but patient states that it does not bother her. Ursula has been educated on home exercise program, adaptive equipment, proper positioning, and environmental modifications to increase occupational participation. She successfully met her long-term goals, and the plan was covered with Ursula. And that is it.